Now that it's summer, let's talk about Lyme disease and ticks. So Lyme disease is caused by a twirly bacteria or a spirochete called Borrelia burgdorferi, and it is transmitted by the Ixodes scapularis tick in the eastern and midwestern states. It is the most commonly reported vector-borne illness in the US. Ticks are most likely to transmit the infection after about 2 or more days of feeding. So if a person reports having had a tick on them for a few hours the previous day, you can just be reassured that you don't need any treatment and your risk of contracting Lyme disease is very low to non-existent. A fully engorged tick can be up to 8 millimeters in diameter, which is almost a centimeter, whereas a typical tick is about 2 to 4 millimeters long. So if you do find a tick on yourself and the tick is still attached, you can remove this. So you can take a clean, fine-tipped pair of tweezers. You want to firmly grasp the tick at the base or as close to the skin as possible, and then pull upward in one steady and careful maneuver. You don't want to jiggle it or twist, as this can cause the mouth parts to break off and stay in the skin. After, you want to clean your skin with soap and water or alcohol. Either take a picture of it, or if you plan to take it to the doctor's office, you can secure it. If not, just flush the tick down the toilet, or you can throw it out in a sealed container with alcohol. So let's say that you found a tick that was super engorged, so you think it's been attached for a while. We can actually give prophylactic or preventative antibiotics within 3 days of that tick removal to prevent Lyme disease or to prevent you having Lyme disease. So this is going to be just 1 dose of doxycycline, and it's the same for adults and children. They can both get doxycycline. We then recommend staying really vigilant and looking out for signs of Lyme disease. If they are noticed, then you would need a full course of antibiotics. So we would recommend then bringing that child in for evaluation. So there are 3 stages of Lyme disease. There's early localized, early disseminated, and late disseminated. In early localized disease, we tend to get a very large characteristic skin rash called erythema migrans. And this can appear anywhere from 1 to 2 weeks after the bite. It starts at the site of the bite and slowly spreads outwards, usually covering about a 5 centimeter diameter. And it sort of looks like a bullseye with a clear center or a target. Other symptoms in this time frame include muscle or joint pains, headaches, fevers, and lymph node enlargement. So the lymph nodes, typically you can find them under the neck, under the arms. You want to look out for those. In this phase, however, so within the first 4 to 6 weeks, testing is usually negative in 90% of patients. Therefore, we diagnose this just based on clinical signs and findings. You can treat with antibiotics at this point. The second stage is early disseminated. So this can occur from about 4 weeks to months later. And it can include multiple smaller lesions like the one I mentioned before, the erythema migrans. But we can also see neurological issues arise at this point, such as peripheral neuropathy, a facial nerve palsy, a foot drop. We can also get inflammation of the muscles of the heart or a myocarditis, which can then cause a heart block or an arrhythmia. It's a type of arrhythmia. Antibody testing at this point will be positive in most patients. So you want to look out for these, get straight to the doctor if you notice any of these. And then late disseminated disease can occur months to years after in untreated patients. The most common complaint will be arthritis, most times in the knee, where the pain is out of proportion to what you're finding and what you're seeing in that knee. So, what about treating before outdoor activities with antibiotics? It's actually not recommended because that's not going to prevent a tick bite. The ticks in this area, about 20% of them will carry Lyme disease, so it's not every tick. And remember, it has to be attached to your body for about 2 to 3 days before it can really transmit that Lyme disease. And so it's just not worth it giving antibiotics beforehand. So that was just a brief overview of Lyme disease.